Friends, good morning. The trial that captivated America more than 2 decades ago, The People versus OJ Simpson, is back in a brand new miniseries.
All rise.
You're going to say this case is all about race?
Yes, because it is.
But a new revelation that OJ could have suffered severe brain trauma during his NFL days is stealing the spotlight.
Well, here to explain is Medical Director of Sports Medicine at Chelsea, Dr. Clifford Stark. Thanks for joining us.
Morning.
So we're talking about CTE, and it's common in athletes from sports like boxing and football where head injuries are common. What is it exactly?
Well, it's a neurodegenerative disease, so it's something that can accumulate over multiple hits, and we really don't know how much trauma is required and how many incidents of trauma. So that's the kind of scary thing. Some people, it could happen after many years of trauma, and some people it doesn't happen at all. The point is that we do have to be aware of it, and it could develop anywhere from years to decades after the last incident of the trauma. But the key is it's cumulative trauma.
So, and some say OJ had it, and you even look at the impact of this. This is the front page of the Daily News this morning. This is your brain on football, and they're talking about the NFL concussions up a stunning 58%. How do we know? I mean, what are the warning signs? Do we have to delve back into his history, those who knew him? We saw him, he was an actor, for crying out loud. We saw how witty he was in the Naked Gun movies and others. So how do we know?
I don't think we do, and I think that it's certainly very high up in the possibilities of what could have caused him to act the way he did. However, there's certainly a lot of other things that could have caused this as well. There's other psychological disorders, or a combination of between CTE and some kind of psychological disorders. So really, we don't.
What are some of the telltale signs that somebody has CTE? Because you can't really tell, right, until after someone dies.
Right, you can't confirm it until after death. But the interesting thing is that I would say probably one of the telltale signs is the lack of judgment and impulse control, which certainly we saw. But again, that could be explained by other things as well. But confusion, aggression, memory loss, depression, anxiety, suicidality is very much talked about.
Some people are just saying, well, this is just an excuse. This guy has had a mountain of excuses for years, and just this adds to that mountain of excuses. I mean, obviously, you're not treating him. He's not your patient. But what do you say to that? Could this be a real problem for him?
It certainly could be a real problem for him. But also, I think it's important for us to be aware of this problem for other people. But as well, we need to be careful not to just use it as an excuse for everybody's.
Yeah, and instead use it as what? A deterrent from, terrible rules in football that can cause more of this to happen. Do you think the football league, do you think the NFL has done enough to change the rules?
It's really a tough question to answer. I don't know how much it's, by nature, football is a rough sport. But I do think that when people are making up their career decisions, even back in high school, when people are deciding whether or not to encourage their kids to play football, I think they need to know that it's not something that necessarily is going to present itself right away. Just because you've survived high school football and you feel fine doesn't mean that you're never going to develop this. This could be decades later. And it also should be noted that this also can cause early death. There's been a lot of people who have died in their 50s because of...
It's amazing. I mean, you look at that cover, and this is your brain on football. They show grayed out areas of the brain. What happens in that portion of the brain that ends up essentially dying?
Well, we think that there's a protein. Well, there is a protein called the tau protein that deposits in that part of the brain. That's really one of the few pieces, but there's probably many other pieces involved in this, and I think that remains to be found.
All right, Dr. Clifford Stark, Medical Director at Sports Medicine at Chelsea. Thanks for your information, your insight on this CTE.
Appreciate it.
Thank you.